Hello everyone. We are going to talk today about what happens to our kids who are diagnosed with autism. I'm going to start a simple thing that everyone understands what's going on and what happens and what's going to happen in the coming future. If we want to put this graph like this is the developmental skills and this is the age. I just pulled till the age of 4. We can put more, but this is the age of 4 to explain correctly what's going on. If we want to compare the developmental skills and age, we check that this arrow going on like this is the normal development of a child according to his age skills. What I'm going to start talking is what happens to our kids between age 1 and 2 years of age. Usually most of the patients or most of the parents who bring their kids for consultation, they say that at the age of 1.5 or 1.2 years of age, my child regressed. So the child was growing normally according to developmental skills, gained their milestones, according to their age, started communication, interaction, good eye contact, following instructions, babbling, started to see some words, and suddenly at age 1.5, most of the parents who report this, their children or their child regresses. So at this point, usually I have 2 types of regression. A sudden regress, that the child loses everything at the same time, like losing eye contact, losing communication, interaction skills, and speech, and become lost. And another type of kids who regress gradually till the age of 2 or 2.2 and loses all their skills gradually. So at this point, what happens? Usually at this point, parents start to search for the medical advices and they started assessing their kids and they are diagnosed with ASD. Then the therapists or the doctors put them on early intervention program, which is like ABA, OT, ST, and all the other therapies. And children start to progress with age. This is an example. They start progressing with age and they gain some of the skills, but they don't progress according to their age groups. So this is the age group, and this is the progress of our autistic kids on therapies when they start therapies after the diagnosing them with ASD. So, and if we check at age 3, we can see a gap between the neurotypical child and the ASD child. And at age 4, we can see a huge gap between both children. So where is the medical intervention in this? As early as ASD is diagnosed, it means that our child was growing normally until something happened at this age and our children are regressing. So if a child was growing normally and gaining all the skills, motor and intellectual skills, and suddenly regresses, it means that something has happened at this age that regressed our kids. Usually, our bodies are made of genes, and everything not us are called epigenes. For example, these epigenes can play a positive or a negative role in our life. So these epigenes could be food, could be water, it could be air, it could be humidity, it could be sunlight, it could be viruses, bacteria, it could be anything from outside our bodies getting in, and it could be vaccines. It could be injections, it could be antibiotics, it could be some medications, it could be milk formulas, it could be anything. So at this age, something happened to my child and started regressing either suddenly or gradually, which means that everything was going normal until this point. So then my child or the ASD child is then growing not according to the age group on therapies. So what I can say that if we interfere by a medical intervention, especially biomedical interventions at younger ages, I just put an example of 3, it could be more, at younger ages or as early as we diagnose them, that we search for the problem and we search for the roots of the problem and not just treating the symptoms. Therapies are very important. ABA, speech therapy, occupational therapy, physical therapy are very important for our kids to gain their skills again. But these therapies are from outside. We need something to push our brains from inside, or the brains of these kids from inside, just to put them on the right track to learn. So I don't want my kid to be a slow learner and a gap will happen at age 5 or 6 or 7 or 8, and it's going to be too late for this child to go into school and to integrate or to start communicating and interacting again as equal to the age group. So as early as we start the medical intervention by diagnosing what is the problem, especially with biomedical interventions, then we can treat the roots and push these kids up as possible as we can, either to be partially normal or normal as a neurotypical child or very close to the neurotypical child. This is what I want to explain about the biomedical interventions and how biomedical interventions and how medicine, if we work from inside, can help our kids to progress and to integrate in the community and be as close or normal kids in the future. Thank you, everyone.